Seeing a lot of variability day to day in the number of COVID-19 deaths being reported across the country, but the average number has been pretty well where it's been for a number of weeks and even months now, sitting in the mid to high 40s in terms of the numbers of deaths every day with COVID-19. In terms of case numbers, we're still seeing that number go up, getting close toward 40,000 cases a day across the country. We have, of course, known for quite some time that is not a true reflection of just how many cases we have in Australia. But one interesting thing that's cropping up just this week is that it's a bit hard to see visually at the moment, but there is a little bit of a slowing in the growth rate of these case numbers each day. And it's a little bit easier to see in New South Wales, where in fact it looks like the beginnings of a bending of the curve there. I think it's a bit premature to be saying this is the end of this wave, or this wave is cresting in Australia at the moment. Still early days, too early to say that, but we'll keep an eye on that curve to see if and when that does start to turn around. Let's also look at hospitalisation numbers. We have more than 4,500 people in hospital in Australia with COVID-19 at the moment. But just like with the case numbers, just like with the death numbers, we know these the interpretation of these figures needs to be a little bit different to what it was 12 months ago when we were talking about Delta outbreaks and the strategy was about containing and controlling entire outbreaks. What we know at the moment is these numbers include not just the people who are being treated for COVID-19 because they're seriously ill with that disease, they also include the people who are in hospital for another reason and happen to have COVID-19. Do we have a good breakdown of how many are in that latter category? Sadly not. I've asked the two most populous states in the country if they can give me a breakdown. Victoria does not keep records of that, and New South Wales Health is yet to get back to me. But the one state we do have a breakdown is one of the smallest states, and that's Tasmania, which has been reporting how many people are being treated specifically for COVID-19. That's the red part of this chart, and how many people are in hospital for some other reason and happen to have COVID-19. They're the yellow people and the yellow part of this chart. And you can see that yellow has grown really quickly in the last few weeks. It's growing faster than the number of people being treated specifically for COVID. And here's another way of visualising this. This is the percentage of public hospital admissions in Tasmania who are being treated specifically for COVID, going back to nearly the beginning of the year. And right back at the beginning of the year, you know, that number was regularly 50% or more of all public hospital patients. It dropped a bit to 40% in the second quarter of the year, and really since June, we're seeing this downward trajectory. There's a lot of COVID in the community, and that is meaning a greater share of the people in hospital who have COVID would not be in hospital if they only had COVID. They have some other reason to be there as well. That is not to say that this wave is not a challenge for hospitals and health systems nationally. Plainly it is if you're seeing surgeries in some states being deferred. But the nature of that challenge is a bit different to what it was a year ago. Now, instead of just dealing with seriously ill people who have COVID, you're dealing with people ill for other reasons who happen to have COVID as well. And there's a lot of challenges in managing that in a health system. And perhaps that also goes some of the way to explaining that while we're seeing case numbers going up, we're seeing hospitalisation numbers going up on the whole, the number of people in intensive care is remaining relatively low and relatively stable.